Hello dear friends, myself Dr. Kanchan Durukar. I am an IVF consultant practicing in Pune since 10 years. Today in this video we are going to talk about is the tubal blockage. What are the reasons of this tubal blockage, how can we diagnose the tubal blockage, and what are the treatment options for this. Now the tubal blockage is generally it generally doesn't have any symptoms. Basically you will have is the problem in conceiving. That means you will have problems in conceiving, infertility we say it as. And generally what can be the reasons for this tubal blockage? So tubal blockage generally happens due to some or the other kinds of infections. So these infections in India, it is more common due to tuberculosis. In foreign world it can be due to chlamydia or gonorrhea. So these are the infections which affects the fallopian tubes and which causes the adhesions formation, or we can say this there is a blockage because of this infection reaction that is happening, and then the tubal blockage that happens leads to the complete block or partial block or unilateral block, bilateral block, whatever it is. Because of these infections will lead to problem in conceiving. Now how do we come to know that there is a tubal blockage? Generally when you consult your fertility consultant, then they generally advise you to do the tubal testing. So tubal testing can be either in the form of HSG, it can be SSG, or it can be laparoscopy. So with this we know whether your tubes are open or whether they are blocked. So if your tubes are blocked, whether it is a unilateral block, whether it is a bilateral block, and we have different terminologies for this tube also. So whether it is a cornual block or whether it is a distal block, that is we call as a fimbrial block. So if this block is there, then depending upon the location of this block, we generally predict that whether we can open this block or not. So if generally the cornual blocks are there, then we try is the tubal recanalization, that is a laparoscopic tubal recanalization we try. And generally more success with tubal recanalization we see in the cornual blocks. But if at all it is a distal block, that is we call as a fimbrial block, and along with that some other a pathology is there, that is there is a swollen tubes, hydrosalpinx, then in these cases generally we cannot do is the tubal recanalization we cannot do, because already the tube is damaged. If at all we open it also, that is not going to help us in giving pregnancy. So this is about tubal blockage and what are the treatment options, that is tubal recanalization. But if at all tubal recanalization is not possible, then we should go ahead with the advanced fertility procedures in the form of IVF. So in the patients who have tubal blockage, bilateral tubal blockage, only and only IVF is what we have in hand. But yes, for unilateral tubal block we can think of going for IUI, but again the success rate is limited if there is a unilateral tubal block. Then tubal recanalization procedure, again there is not 100% surety that we are going to get the patent tubes after we do the tubal recanalization procedure. As I earlier also said, that cornual, if the blocks are there, then more chances of getting success with tubal recanalization is possible. So these are the in this video we got to know about what is the tubal blockage, how it is diagnosed, that is what are the methods to know the tubal patency, then what are the reasons for this tubal blockage. As I already told that in India tuberculosis is the most common reason for this tubal pathology or tubal blockage. Then we discussed about the options in nutshell, that what can be the options for these blocked tubes. So generally if at all you are not able to have the tubal recanalization, successful tubal recanalization, or if at all the tubes are damaged already, then we should not actually attempt for tubal recanalization also. We should go for is the IVF technology, which can help us in giving pregnancy. Also in this when we are going for IVF procedure also, if at all the hydrosalpinx is there, hydrosalpinx means the tubes are filled with fluid, some fluid. So this if the your tubes are filled with fluid, again it is deleterious, it is detrimental for the embryos that we are transferring. So before going for embryo transfer, we generally do is the tubal clipping, or we do is the ostial fulguration. So these are the advanced methods where we don't want the fluid of that hydrosulfings to come into your uterine cavity. So for that we do is the cut down these tubes from your uterus, so that the embryo that we are transferring, that should get implanted and grow into a healthy baby. So these are some recent methods which we do for the patients with tubal factor of infertility. So in India we have 10% of the patients with tubal factor of infertility, but yes, we have the recent advances also available, which can we can do, and we can overcome this tubal factor of infertility, and we can achieve pregnancy, my dear friends. So this I hope this video was informative for you. Thank you very much.